I watched an American patient do something strange. He walked into the hospital, looked around, and relaxed. Not because he felt safe. Because he felt rich. He whispered to his wife, "We're fine. We can afford this." The nurse called his name. No clipboard. No prices. No card reader. Just his name. Halfway through the visit, he leaned toward me and asked quietly, "So when do I start negotiating?" "Negotiating what?" I asked. "Everything," he said. "Time. Tests. Priority." I told him, "There's nothing to negotiate." He laughed. Thought I was joking. Then the bill came. He stopped smiling. Not because it was expensive. Because it wasn't. He stared at it like it was missing a page. Then he asked a question. I hear every week, "So how do I make sure they treat me seriously?" I said, "You don't." And that's when he got scared. Because for the first time, money wasn't protecting him. Complaints wouldn't help him. Confidence didn't matter. Only the system did. And that's when I realized, Americans don't struggle with our healthcare system because it's confusing. They struggle because it doesn't need them. If you want to understand why that feels so uncomfortable, and what happens next, subscribe. This story only makes sense if you hear the rest. I work in administration at a medical center in Bavaria, and Americans arrive carrying the same belief every time, that the system is broken until it proves otherwise. Their first question is always money. Nothing unsettles them more than a doctor who has no idea what their credit limit is. One American patient insisted on recording his appointment for legal safety. The doctor said no. "Why not?" "Because this is medicine, not a courtroom," the doctor replied. The man paused, then slowly switched off his phone, like he'd just lost a weapon. A woman asked if she could tip the nurse for better care. The nurse stared at her, confused. "I'm already doing my job," she said. "Yes," the woman replied, "but maybe better." The nurse blinked. "Better than correct?" she asked. At check-in, an American woman asked if she could upgrade her appointment. "Upgrade how?" the receptionist asked. "Longer time. Better doctor. Kindertone." She listed them carefully. "You booked healthcare," the receptionist said, "not a hotel room." The woman wrote that down, like a threat. A man leaned toward the counter. "So when does the real bill arrive?" "This is the real bill." He laughed, uneasy. "No one survives on this." "We do," I said. "Collectively." He shook his head like I'd confessed to something illegal. At reception, an American asked if paying cash would get him seen faster. "No," the receptionist said. "But I'm offering money." "Yes," she replied. "And we are offering time." "You already booked it." He stared at her, stunned. Like a bribe had just failed. One man leaned across the desk. "Should I mention my insurance is premium?" "Doctors don't see that," I said. He froze. "Then how do they know how serious I am?" "They examine you." He laughed. Not because it was funny. An American once asked if doctors get bonuses for faster care. "No," I said. "Then how do you motivate them?" "They're paid well, and not sued constantly." He shifted uncomfortably. "That sounds risky." A man asked to switch doctors because he didn't like the tone. "The tone?" "Yes. The vibe." I explained that doctors here don't compete for likability. They compete for outcomes. He looked disappointed. An American woman demanded printed test results before the tests. "For my records," she said. "You don't have results yet," the technician replied. "Yes, but I like to be prepared." "In Germany," she said, "we wait for facts." A man requested a referral, just in case. "For what?" the doctor asked. "Everything." The doctor laughed. "That's not how bodies work." The man seemed offended by the idea of limits. An American asked why no one automatically offered a second opinion. "You can request one," the doctor said. "But you didn't suggest it. Here, we assume competence until proven otherwise." He didn't like that. At billing, an American stared at his receipt for a full minute. This can't be right. It is. Where's the facility fee? There isn't one. Administrative fee. Included. Emotional distress fee. He was serious. A man demanded the doctor squeeze him in. The nurse said no. In America they always squeeze. Yes, she replied, and that's why you wait an hour even with appointments. He said that was different. Without knowing why. A man arrived 30 minutes early and demanded to be seen immediately. I'm early, he said proudly. Yes, the nurse replied, and the doctor is still with the previous patient. But I planned ahead. So did they. An American asked how much extra it cost to see the best doctor. You'll see the assigned one. But I want the best. They all are. He frowned. That doesn't make sense. Another man asked if he could bring his own doctor. For oversight. To make sure you do it right. The German doctor smiled thinly. I already passed medical school. The man didn't smile back. An American couple arrived with a printed spreadsheet of symptoms. Columns. Colors. Notes. The doctor glanced at it, then at them. When did this start? Page 4, they said together. He closed it gently. At a follow-up visit, an American whispered, he feels cold. He's focused, I said. In America they smile while billing you. I didn't know how to answer that. It felt uncomfortably accurate. By the end of the week, I saw the pattern. It wasn't confusion. It was grief. They were mourning a system where money feels like safety. Here it doesn't. And that frightens them more than illness ever could. An American demanded to speak to whoever was in charge after being told no. I am, the nurse said. No, the real one. She pointed at herself again. This isn't Starbucks, she said, and returned to her screen. A woman threatened to complain to corporate. Which corporate? I asked. The hospital corporate. I explained the hospital was public. She stared. So who do I threaten? Your expectations. An American leaned in and whispered. My lawyer will love this. The doctor nodded. Good. Maybe he can explain German law to you. I meant your lawyer. We don't bring lawyers to checkups. A man insisted his issue was urgent because he felt anxious. The nurse asked if he was bleeding, fainting, or unable to breathe. No, but I'm uncomfortable. Then you're scheduled. She closed the window. An American demanded walk-in service. This isn't urgent care. No. But I didn't plan this. Yes, and we did. That ended it. A patient asked why he had to share a waiting room. I'm not comfortable with other people. They are also people. He looked offended by the math. An American quietly slid his card across the counter. For faster service. The nurse pushed it back. Without touching it. We don't sell time. He looked embarrassed. Then angry. Then helpless. A man said, in America, I'd never be treated like this. The doctor nodded. Yes, and that's why you're here. The silence afterward felt medical. A woman asked how the hospital improves without satisfaction surveys. We track outcomes, the administrator said. She frowned. But how do you know if people felt satisfied? They recovered, the administrator replied. She didn't look convinced. After 10 minutes, an American stood up and announced, I've been waiting. Yes, the nurse said, so has everyone else. He sat down slowly. Like that idea had just been introduced. A man began listing everything his insurance covered. The doctor stopped him. I don't need that information. But it's expensive, the man argued. Yes, the doctor replied, and that's between you and your country. An American patient asked what happens next, step by step. The nurse explained the process. And after that? We see. He didn't like that. We see. He repeated. Yes, she said. That's medicine. A man asked for a guarantee. Of recovery. The doctor laughed once. If I could guarantee outcomes, I'd be a god, not a physician. The man didn't laugh. An American asked why someone else was seen first. They arrived earlier, the nurse explained. But I'm more serious. She checked the chart. No, she said. You're just louder. A woman crossed her arms. This system doesn't care about individuals. The doctor nodded. It cares about everyone. That's the problem, she replied. A man finally snapped. So what am I supposed to do? The nurse answered calmly. Wait your turn. Follow instructions. Trust the process. He looked like gravity had just been removed from the room. An American whispered, This feels like punishment. No, the doctor said. It feels like equality. The man stared at the floor, like he'd lost an argument with reality. By now they weren't confused anymore. They were angry, because the system wouldn't bend, or bargain, or smile, or negotiate. It just worked. And nothing frightens people more than a system that doesn't need them to fight it. An American finished explaining his case and waited. The doctor didn't interrupt, didn't nod, didn't reassure. He just listened. 5 seconds passed. Then 10. So, what do I do now? The man asked. Now I decide, the doctor replied. A woman asked if she could choose her treatment plan. No, the doctor said. You can ask questions, but treatment follows evidence. She crossed her arms. In America, we're involved. Yes, he replied, and exhausted. In the waiting room, an American whispered, Who's ahead of me? Everyone who arrived before you. But what about urgency? The nurse pointed to the triage chart. That's based on condition, not confidence. A patient asked, What happens if he disagrees with the diagnosis? Then you seek a second opinion. But you don't negotiate? No, the doctor said. This isn't a marketplace. An American executive noticed he was seated beside a janitor. He leaned toward me. Is this normal? Yes. We're both patients, the janitor added, without looking up. The executive said nothing. A man asked when VIP patients arrive. The nurse smiled. We don't have VIPs. He scanned the room again. So no one gets special treatment? She shook her head. That is the special treatment. An American woman sighed. This feels like karma. The nurse nodded. Yes, because no one is fighting. The woman looked surprised. Is that allowed? A man whispered, so if I stop pushing, it still works. Yes. He leaned back slowly, like testing a chair he didn't trust. It feels wrong. That's because you were trained to struggle. Another patient stared at his hands. I thought healthcare was supposed to hurt. The doctor looked up. Pain isn't proof of quality. The man nodded, like he was hearing a new language. Not everyone accepts it. Some leave angry. Some leave offended. Some leave convinced. Europe is broken. But none of them leave confused. They understand the system. They just don't like what it reveals about theirs. One American paused at the door. So who's responsible if something goes wrong? The system, the doctor replied. The man nodded slowly. In America, it's always the person. Yes, the doctor said. That's the difference. They came seeking better service. They found equality. They came ready to negotiate. They found rules. They came with money. They found limits. And nothing scares people more than a system that works without asking who you are. An American called 2 days later. I think something went wrong. What happened? Nothing. Exactly. The quiet scared him more than pain ever had. At check-in, a man placed his credit card on the desk out of habit. The receptionist ignored it. He slid it closer. She pushed it back. You won't need that. He held it the entire visit, like a security blanket. One woman returned just to say thank you. Not loudly. Not dramatically. I didn't have to fight. The nurse nodded. No, you just had to wait. The woman smiled, confused but relieved. An American began explaining his insurance automatically. Halfway through he stopped. Sorry. The doctor waited, then nodded. That habit fades slowly. The man looked embarrassed, then lighter. A man said, I'm going to leave a review. The nurse smiled. You can. That won't change anything, will it? No. He lowered his voice. That's unsettling. An American asked if he'd received the basic package. The doctor looked confused. You received care. Yes, but was it the best? It was the necessary one. The man leaned back, defeated by logic. A woman closed her eyes during an exam. Didn't watch. Didn't question. Didn't record. Afterward she said, I didn't know I could do that. Most people forget. Not everyone adapts. Some still push. Some still threaten. Some still explain how things work back home. The system doesn't respond. It just continues. Steady. Unimpressed. A man whispered, so I don't have to manage this? No. Then what do I do? You heal. He stared at me like no one had ever said that before. They arrived thinking healthcare was a transaction. They left understanding it was infrastructure. They came armed with money, lawyers, and leverage. They left with instructions and time. For some that was terrifying. For others, it was the first rest they'd had in years. By the time they leave, nothing is broken. Nothing went wrong. Nothing dramatic happened. And that's exactly what unsettles them. Because there was no fight to win. No system to outsmart. No one to blame. Just rules. Applied evenly. Some people walk out angry. Some walk out offended. Some walk out convinced this can't possibly work. But a few walk out quieter than they arrived. Because for the first time, healthcare didn't ask who they were, what they earned, or how loudly they could speak. It just did its job. And once you've seen a system like that, it's hard to unsee what yours has been asking from you all along. If this story made you uncomfortable, that's not an accident. It means it worked.